This morning I'm going to do a nasotracheal suctioning. So the first thing I need to do is check the charts before I enter the room, and then also gather all my necessary items that I will need to perform the procedure. So once I'm ready, I always introduce myself to the patient, and then I'm going to wash my hands, make sure my hands are clean, then I'll apply the appropriate PPE. Right now I'm just going to wear gloves until I am ready to do my procedure. So I'm going to prepare the patient. So before I begin, I always check the patient's patient ID. So I check their ID, and then I check their vital signs. I'd listen to their lungs and see what the lungs sound like, see if there's a blockage somewhere, if I hear something gurgling or anything like that. And so always before I do a nasotracheal suctioning, I always need to oxygenate. So I'm going to get them set up on some oxygen with a non-rebreather here. And as always, with a non-rebreather, always make sure the bag properly inflates. And so you always want to hyperinflate the lungs to get their lungs open. And then I'm going to prepare the tubing to the nasotracheal suctioning kit here. I got to make sure I have no kinks. Make sure everything stays in place. So I'm going to stretch it out a little bit, not too much, just enough to make sure nothing gets caught in the tubing. Then I place it on. And you never want to go past 150. So if you occlude the suctioning here, then you can see where you're at. So I'm going to set that there so it doesn't get infected with anything. And then I'm going to remove my PPE here. I'm going to wash my hands. And then I'm also going to get ready for my suctioning here. So I'm going to make sure I have my gloves and everything out ready to go. And I'm going to, without trying to touch the outside of the gloves, I need to try to place the gloves on, the sterile gloves. And as always make sure you have your lubricant ready. You can always put lubricant on the lid here, or you can put it on clean gauze. So I always want to pour in sterile water into the catheter here. Make sure that it's sterilized. And then I would take my suctioning tubing here, and with my non-dominant hand, which is my left, and then I would grab my other hand and I would place it into here, and then you start to hear like a hissing sound, and that tells you that it's placed in. So with this, you always need to re-sterilize the end piece of the catheter to make sure it is also suctioning right, and to lubricate the inside of the tubing. So then we would take the end of this and then we would wipe it into the lubricant. That way it's easier to place into the patient. So as always, before you place in any catheter or anything like that, you always want to make sure the nares, there's nothing that could obstruct anything that I could catch on. So when I'm ready, I can remove the oxygen, and then I would place it in. And you can do it without the nasal trumpet if you do not have one, so I don't have one today. So I'm going to place it in very carefully into the patient's nose. And if I happen to notice that it gets caught, I can have the patient cough for me. That way I get it into the appropriate place. So you don't want to be in there for more than 15 seconds. So you would inch it out of the nose very carefully not to splash anything. And then I would go, and if you want to do it again, then you can go in here and you can do the sterile water, put some more sterile water in there to make sure it's nice and clean. Then you can redo it again if you want to, if you feel like you need to suction out more out of the lungs, but you don't want to do it more than 3 times. So when I am always finished, I always want to set it on them on oxygen again. With their lungs. And when I'm all done with this, I would circle it around here very carefully, not to splash anything, get anything affected. Then I would remove it with my gloves. I can set this here and remove the proper PPE. So always with like any suctioning, anything that could have bodily fluids, you always want to make sure you have your mask, anything like that, a gown. Even like for like me with my hair, I want to make sure my hair is up in a cap so that way it doesn't fall into anything and get infected with anything. So then when I am done, I can get everything done. I check the patient again. If I know the patient's okay, I could remove the oxygen from the patient. And then I would reassess the patient, listen to the lungs, see how the sounds are, see if I hear any more gurgling, if I hear anything else in the lungs, if I need to come back later to resection again. So I chart down everything that I have done. Always make sure that my hands are clean before I leave the room or do anything else with the patient with that.